Joining me now is Vermont Senator Bernie Sanders, who was in that hearing today. Senator, what was it like hearing your colleagues bring back old talking points today?
Well, Al, it just makes you realize how desperate the Republicans are in terms of health care. They have nothing to offer. Under Bush, for 8 years, they had nothing significant to say about expanding health insurance to the uninsured. And in recent years, all they could do is talk about the problems of the Affordable Care Act. They are very, very upset that we have now over 8 million people getting their insurance as a result of the Affordable Care Act through the exchanges. They are very upset that young people now are getting insurance on their parents' programs, and they're equally upset that millions more people are now getting Medicaid through the Affordable Care Act. The real issue is, to my mind, how could it be that Republican governors all over this country are denying health insurance to their people who desperately need it, even though the federal government is picking up 100% of the cost. Now, bottom line, these guys have nothing to say.
You know, Senator, it's almost unreal that we're talking about people that are upset that people have health insurance, and governors, as you say, blocking health insurance for their own state Senate citizens when 100% of it's paid by the federal government. But the good news is that Democrats are starting to stand up, because today we saw going on the offensive was North Carolina's Kay Hagan in that hearing today. Watch this.
Last year in North Carolina, our state legislature and governor decided against expanding the state's Medicaid program. And as a result, about 500,000 people who would have qualified for coverage through Medicaid are now not able to do so. These are some of the most vulnerable citizens in our society who will continue to seek care in emergency rooms and then will leave chronic conditions unmanaged.
So, Senator, I mean, she's in a tough race back in North Carolina. Politically, is this a good issue for her?
I believe it absolutely is. You know, Al, forget politics for a moment.
Right.
What does it mean that if I make $25,000 a year in North Carolina, if I have an illness, if I have no health insurance, I can't get to see a doctor? I can't go to a hospital without going bankrupt. And I think that every one of those citizens in North Carolina and throughout this country who are entitled to health care and are not getting it, I would stand up and say to the governor, how come you are not allowing me to get the health insurance that the federal government is allowing me to have? I think it's a huge political issue.
Now, you know, another GOP talking point was that the law was unaffordable. But a brand new analysis shows the law helped bring down health care spending by $900 billion. I mean, another talking point to hold a funeral for, Senator?
Absolutely. Absolutely. You know, health care costs in America are still much too expensive, no question about that. But what experts now tell us is, a result of the Affordable Care Act, we are beginning to slow the growth of health care costs, and that is extremely important. Look, Al, at the end of the day, if you don't believe that people are entitled to health care, if you want to cut Medicaid drastically, if you want to end Medicare as we know it, and you have legislation which is now working, and you're a Republican, you've got a problem. You got a political problem, you got a public policy problem. And these guys, in my view, are in trouble as a result of that.
You know, we mentioned that the insurers said in the House hearing yesterday that most people have paid their premiums. The New York Times also reports, quote, insurers appearing before panel of the Energy and Commerce Committee testified that the law had not led to a government takeover of their industry. So if the business people say it wasn't a government takeover, I mean, isn't that another dead talking point, Senator?
Yeah, I think it is. But I have to tell you, Al, as you well know, I happen to believe that Medicare is a very successful program. I believe in a single-payer Medicare for all.
Right.
The president does not.
Right.
The Affordable Care Act is not a government takeover of health care. Far from it.
No, and I'm glad you said that, because many of us, I included, wanted single-payer plan. They act as though this is some far-left progressive notion when it really is not. It certainly helps millions of people, but to act like he's like gone over the deep end left is just absolutely not true.
Al, you know that the fundamentals of the Affordable Care Act were developed in Republican think tanks as an opposition approach to a single-payer approach. And the first state to implement something like the Affordable Care Act was that communist state of Massachusetts under Mitt Romney, that well-known communist revolutionary.
Senator Bernie Sanders, thank you for your time tonight.
Thank you.
Breaking news. Moments ago, the Republican-controlled